Welcome. My name is Ramadhani Abdallah Noor, and I am a medical doctor and a research associate from an organization working with an organization called Africa Academy for Public Health, based in Tanzania. I'm going to talk to you on managing subcontracts and consortiums for NIH and federal funding. So to start with this talk, I will start by giving you a bit of a background as far as managing subcontracts and consortiums for NIH and federal funding. We'll touch on some of the key areas in terms of sub-grant management. We'll touch on a bit on the foreign organization system review, and then the common compliance pitfalls and strategies to overcome them or success, and then lead you through on where you could find some more case studies as far as this subject concerned. So as a background, really managing subcontracts and consortiums for NIH and federal funding, it matters a lot, and it's mainly about having systems in place and procedures, as well as activities and compliances towards those international requirements, or the donor funding, the funding organization requirements. These should cover the whole spectra, starting with the pre-award, during award phase, as well as the post-award. Now, to be able to have a good guidance throughout the whole cycle, the grant management cycle, on what things to do or what things not to do, there are some guidelines that exist, and I would like to bring this forefront for your attention to be aware of where you could access some of these resources that will be very useful in terms of guiding you. The first thing that it's important to be aware of is that NIH as a funding organization has a grant policy statement that is usually oftentimes updated on an annual basis, and these will give you guidance on some of the micro details on related to the activities pertaining to grant management. You will also receive with every grant award a notice of award that also speculates some of the guidance useful for your grant management. We expect that you also have at your level of the institution, you'll have institutional policies. And in addition, there will always be some reference that will be done from Code of Federal Regulations. You hear about CFRs, as well as from some circulars from Office of Management and Budget. As a prime administering a subcontract, you have to assure NIH that you will hold all your subcontractors to the policies required to comply with the funding regulations. Now, the scope of issues that relate to grant management and consortium management for NIH and federal regulation is so wide. It ranges from general issues, but also it goes to very specific issues. Let's say some guidance as how you will develop and submit your application, what kind of procedures you need to have in place or policies at your own institutions, how you should go about monitoring your grant, how the scientific and the fiscal systems and operations will overlap, the standards of conduct, the agreements, different types of costs that are involved, allowable and unallowable, how you manage your records, to the very specific procedures or activities like travel, procurement, personnel, time and effort. So the scope is really wide. And that's why it's very important to be aware of where exactly you can receive some guidance on how you should go about whenever you're implementing some of these grant-related activities. Since when I started, I touched on the NIH grant policy statement as one of the key documents that is available for guidance. I better talk a little bit about this document. So this document, you will have access to it through the NIH website. And this document, again, takes you step by step and gives you guidance. It is divided mainly on three main parts. And the first part is really to give you the NIH grants information, and this is the general information. The second part of this document goes in details to tell you more about the terms and conditions that are tied to the NIH awards. And it's also divided into two subparts. where the subpart A, which is very general, and the subpart B, which will go into very specific details on that particular type of a grant or different types of grants, different types of grantees, as well as activities. And the last part in this document is that is the third part, which really gives you various points of contacts within the NIH. The most important thing to remember as far as the NIH grant policy statement concerned is that this document is updated on an annual basis. So you have to be sure that whenever you're consulting or you're seeking guidance from this document, you're actually doing it from the updated version or the most current version. In terms of general issues, when you talk about general issues, really we are looking into issues such as the good organizational charts, how you should organize your the organograms for your organizations, how they should be presented, the clear identification of the responsible person within that grant as a team, as well as the very specific terms of reference for your various key members that are actually involved in that grant. It will guide you on how to present the clear lines of sort of delegation authorities, how you should structure your communication, clear communication lines, as well as the very essential required registrations that are needed for your organization, as well as for your principal investigators who are actually leading those type of grants. When it comes to policies, procedures, as well as the standard of conduct, we expect, and actually the guidance, you'll receive guidance in terms of what types of policies you need to have in place at the institutional level. For example, you will find the policies for research misconducts. There'll be policies and guidance in terms of, or guidelines in terms of conflict of interests, confidentiality agreements, and so forth. These various types of policies or guidelines, institutional policies, need to be well documented, need to be approved versions. Then after having these policies in place, the next level is really to make sure that all staff to whom these policies apply are sufficiently trained, but also you demonstrate some evidence in terms of different ways of enforcing these kind of policies at the institutional level. In terms of preparing your application, it's important from the beginning to realize that this is a teamwork, and you will have a lead person who will be the principal investigator, but the whole team needs to be coordinated from the very beginning in terms of understanding from the first place, understanding the RFA, the call announcement requirements, and be able to think together in terms of how you as a team or the institution is eligible to that particular RFA. But also, what will be the overall impact of what you're trying to submit for funding. It needs, when you work out with your team and you're developing your application, it's important to make sure that it's reviewed sufficiently and it's supported by the institution. If an application is being developed in a consortium sort of an arrangement, it's important to make sure that all members or different entities that belong to that consortium have adequately participated, they have reviewed, they've made their inputs, and they all support that application before it's being submitted to for funding to NIH or for any other federal entity that has released that RFA. It's important also to think ahead in terms of what sort of peer review you will seek, you will go through, and also to relate that sort of review with the structure and how the scoring is done or is going to be done. The scoring for your application is going to be done when it's being submitted at the funder's office, in this case, let's say NIH. It's important to run these things and to work with your finance and accounts team, because again, as you develop your activities, deliverables, and milestones, you also want to tie that very closely with your team that will develop the budgets. The team that works on the budgets will have to make sure that really whatever inputs they make on the budgets are supported sufficiently by the verifiable information. The budgets that are being presented or brought in place are based on true costs, and they've sufficiently been reviewed by the whole team within the finance unit or the accounting unit. Again, together as a team, you have to think of the mode of submission, and in this case, nowadays it's electronic submission, which needs to be well understood and thought about ahead of time. Again, this is to avoid the last minute surprises. When it comes to electronic submissions, sometimes, and especially when it's the first time that you have not had people who had experience to go through that procedure, it may be technically difficult, and it may require some support. So you've worked very well with your team and you have been successful. You have received the grant. You will typically receive what they call the notice of award, and then you will go ahead with various other different types of agreements that might be applicable for that particular type of a grant. You'll have your approved proposals or protocols depending on the nature of the grant itself. What is key then is really to be able to have a system in place that will allow you to do periodic sort of programmatic reviews in terms of how you implement that particular grant. You will need to reflect on your deliverables. You need to review your deliverables and the milestone frequently to see whether you're on track. That's the first thing, but also to see whether not only that you're in the right direction, but also those deliverables and milestones are being achieved as planned on the initial approved application. And again, this review should also be not only on the scientific aspects of the grant, but also on the financial aspects, the management aspects of it. For example, you need to review in terms of your actual expenditures vis-a-vis the budgets that you had in place from the first place. It's important to be also very, very vigilant in terms of how your fiscal as well as scientific operations overlap. And especially in this case, it's very, very important for your team, particularly your grants management team, to help the scientists or the team that takes lead in that particular project in terms of avoiding any duplication of payments. And in this case, I could give you an example that you might have payments that are done, either they're being duplicated within the same research, for example, within the same equipment in different grants, or time of researchers, which is a very common example, the effort, what we call the effort, being sort of duplicated within the two different grants. So avoiding these kind of things will help you to be able to justify but also report your grant progress much better as you go along. When you're implementing your grant or you're managing your grant in a consortium arrangement, then there are few things that are important from the beginning to think about. One of it is it's important from the word go, from the start, to think adequately as a consortium and agree on mechanisms that you'll have in place to steer the whole team forward so that you could move as one consortium, because a consortium can have 3, 4, 5, or sometimes even more institutions involved. And in those kind of arrangements, it's not uncommon that to have one institution lagging behind or disagreeing on something, or a few of institutions that are involved within the consortium making much more steps forward, making progress much faster than the rest of the members. So to avoid that, it's important to have an agreeable way to steer all members forward. You need to agree on how you're going to have decision-making mechanisms within your work. You will need to think about having things like communication plans, which will sort of guide each member of that consortium on how to communicate, when to communicate, so that you could harmonize and pretty much standardize the way you communicate as one team, and rather than communicating as differently, and you might be perceived as sort of having different or sub-teams within one bigger team. Some of the things that you are key to touch on, important area as far as grant management and consortium management, particularly for grant management, I think you'll hear a lot about the indirect costs. And as far as indirect cost concerns, I would say a few things. One, I think it's very important to have a very good understanding on what is the rate, what is the allowable rate for the indirect, what are the policies concerning indirect costs for that particular fund, and in this case NIH. What rate is allowable to deduct as indirect costs? How should you go about it? How are those costs? What are those costs? Are they clearly identified? And again, if you go to your NIH grant policy statement, it will give you a very good guidance on how you should go about your indirect costs. But what is key here, again, is to note that the indirect cost should not be, and in some cases, some institutions will make that mistake, should not be deducted ahead of time. So suppose you receive your grant today and you receive an installment, you may not go ahead and deduct your indirect costs, but rather you should end those indirect costs after you have sort of gone through some of the activities and expenditures. Then you'll be able to earn that particular percentage from the money that has been spent. As far as records management, I think it's important to have the right policies in place, and this will guide you how you should go about collecting your data, store your data, archive your data, but also dispose it. This should cover a whole range. It's not just the data from the field, but including the biological samples. And here you should also look at the material transfer agreements and data management plans, what sort of data sharing agreements that you need to have in place. In terms of banking and payment, usually you will need to have separate bank accounts for the grant. It may not be possible to have, in practice, really different bank accounts, but you might come up with an arrangement that within one account that, let's say it's an account for NIH funds, you might have different projects or different grants with different codes, so sort of having sub-accounts in it. You need to maintain accounts that allow electronic transfer of funds. You need to have systems in place that sort of guide how you can initiate, how the payments are authorized, how are they approved, and usually the authorization is expected at least to be preferably coming from 2 authorities within the institution. As far as budget preparation and controls, the most important thing here is to make sure that you keep monitoring your burn rates on monthly basis, on quarterly basis, vis-a-vis the actuals that you had on your budgets. You need to have internal control mechanisms that can be in a form of an independent accountant, or it can be done as, through the internal or government auditors. And what we need to also be mindful here, if your institution receives in aggregate a total of $500,000 or more federal funding, then you need to have a special type of audit that is being actually in accordance to the a particular circular, which is the OMB A133. And this special of audit, you will receive guidance from the NIH policy statement on how you should go about it. As far as personnel and payroll concerns, for personnel, you need to have written policies, manuals in place, job descriptions for all your staff, annual evaluations being done, the time and attendance, this is the effort, well reviewed and updated every quarterly or every month. The payroll needs to be generated based on the percentage effort each of the staff is put in various projects that they're involved. It needs to be verified by a second person and approved by the PI, and the payments should be in the form of direct deposit. When it comes to procurement, property, assets management, you need also to have written policies at the institutional level. You need also to be mindful of the local applicable or the national procurement acts that actually you might need to comply. For some large expenditures or large purchases, you might need to have 3 quotations, or you might need to find out what sort of guidance you have in place on your procurement act as how you should go about it in a manner that is most compliant. These procurement laws, again, are applicable in a whole range, not only just the procurement of your capital, infrastructure, or assets, but sometimes some of these laws are translated into how you should hire your staff, how you should go about the hiring, and so forth. As far as property management concerns, all that belongs or has been obtained through these grants needs to be registered, needs to be recorded, the appropriate inventory needs to be maintained, as well as how you should go about it. As far as travel, again, you will notice with everything you need institutional policies in place, how the travel is being approved, how the claims are being verified, the per diems are being sort of arranged, how you should organize your travel. Again, the most direct rules. You will not be able to exceed the coach class fare. The guidance from the NIH policy statement will guide you to travel with the US flag carriers, and in place where you don't have the US flag carriers in place, usually you'll find some airlines which are partner airlines, and those will be compliant. You should also be mindful of any US foreign travel restrictions that may be existing by then. You may at one point or another be involved or required to participate in a financial system review, which is called a Foreign Organization System Review. This is really not an audit, but usually it's an assessment or a review that is done to sort of assess the ability to manage US federal funds in an accountable manner. And usually it will be contracted to a third party by the funder. They will come and work with you to assist your compliance in terms of NIH conditions, provides a global outlook in terms of the internal procedures that you have in place, what needs to be improved, and really it focuses on promoting the understanding between your team to the different or various type of guidelines that you need to comply. Now, in terms of the common compliance pitfalls, as you would see, the scope from the beginning, it was so wide, but some of the common pitfalls that most teams have experienced is that they might find it tricky to deal with what is allowable and unallowable costs. Sometimes you might find that the misallocation of costs, excessive cost transfers, inaccurate effort reporting, or inadequate sub-recipient or sub-grantee monitoring. Sometimes they might have issues with how you go about the closeout. So these are some of the common pitfalls. If you go to the NIH site, you will find additional resources that will guide you beyond the policy statements. And I think one of the things that you might find is there is a collection of case studies which have been collected and generated from experiences that different grantees have had in terms of compliance pitfalls, as well as strategies to avoid them. And I think, as you see, this slide will provide you the information that can allow you to search for those case studies, which will be a very good way forward for those who are interested to learn more about NIH grant management as well as consortium administration. Thank you very much.